Friends, if you can't control urine, that means you've got incontinence of urine. It's time to see your urologist. Be it a male, be it a female, be it a youngster, or be it an elderly. It is important for us to identify ourselves as being in normal health. And therefore, bringing to the health row seat is probably a major attempt at the Kokila Ambani Hospital in the Department of Urology. I, Dr. Sanjay Pandey, heading the Department of Urology at the Kokila Hospital over the last 15 years, look forward to again bringing a campaign on this important missed out subject where the awareness is on the lower side called continence of urine, where incontinence becomes quite a difficult situation for women. So if you are a woman, if you can't control urine and you leak urine, it is important for you to wake up to this phenomena that there is a treatment and a cure available. Sadly, because people don't know, they continue to live with incontinence. Friends, it's time to leave incontinence rather than living with incontinence. And let's discuss this in short as to what is the requirement of awareness. So when bladder is to be blamed, that means when the cause of leakage of urine, where there is increased frequency of urination in day and night, where there is an urgency where you can't control urine, and there is a leakage of urine called urge incontinence, it is important to understand that this is a possibility of a bladder gone wrong. So bladder is contracting erratically, which is called as overactive bladder. That means the bladder, which has a capability of gradually relaxing and holding urine for you to be socially continent and reach the washroom, open your zip and empty urine, the bladder is contracting erratically. And that's what we call as overactive bladder. The bladder is just contracting erratically. So this bladder, an overactive bladder, brings about changes where you learn to live with increased frequency of urination more than 8 to 10 times in the day. Some people go 10, 15, 20 times. They get up multiple times at night. There's an urgency where they can't control urine and they have to rush to pass urine. And sometimes they leak urine before reaching, or many times they leak urine per day, per week, which is called as urge incontinence. So the incontinence of urine, the bladder is to blame, or the bladder's cause of the bladder contracting erratically and making you run again and again. That means you were a master all your life, but suddenly you become a slave and the bladder decides when you will go, or you really can't reach urine. It's called overactive bladder. The bladder is just overactive. And let's take women who leak urine when they cough, when they run, when they jump, when they climb stairs, when they bend forward to work at home in domestic work, or they bend forward for namaz, for their prayers, and they leak urine out. This is called stress incontinence. Stress incontinence is a phenomenon which can happen to young women, which can happen to middle-aged, postmenopausal, and elderly women, our mothers and grandmothers. And what happens? The pelvic floor, which houses or which supports the uterus, the vagina, the various organs, the floor component, gradually turns weaker with every delivery, which needs to be recoiled with Kegels exercises, which can be missed out. Or it weakens up because of the obesity and the weight. It weakens because of the age and hormone-related changes and development of a menopause state where the whole thing becomes loosened and weakened up. And probably any kind of a stress to the pelvic floor causes a leakage called as stress incontinence. So stress incontinence is not the mental stress. The stress here is a stress to pelvic floor, which, as I said, with minimal amount of pressure on the tummy, leaks urine out. So stress to the pelvic floor can happen when you get up from bed, when you walk, when you run, when you play badminton, when you play kho-kho, or when you bend down for your prayers, bend down for work, or when you run up the stairs to catch a bus. So if women go through this problem, they could even be very young or could be very elderly. They could be suffering with this for weeks, months, years, and even decades. Many women sadly live with diapers, smelling of urine, infected, the skin infections, and this is not right. At the Kokila Ambani Hospital in the Department of Urology on the second floor in Andheri West, it is time to probably wake all of us who are women and who probably go through this phenomenon of leakage of urine. So if you are leaking urine, you can't reach the washroom because there's a stress incontinence of the capability where the pelvic floor is weak. This has been happening for a long time. or the bladder makes you get up and makes you rush, make you leave a meeting, leave a talk, leave your work, then an overactive bladder. So either you have a grossly overactive bladder, or you have a stress incontinence, or you could have a mixed incontinence, a combination of both in the prime of life and beyond as a result of aging changing processes both in the bladder and the pelvic floor. So this is an attempt to make women understand that let's not live with incontinence anymore. Let's not live with increased frequency, urgency, and debility, where women start mapping the toilets, start drinking less water, live in dehydration, live with urine smelling dirty and stench, and probably getting infections, not able to maintain the hygiene, which is always a wetness in the region of the introitus. So friends, it is only an awareness to take you forward that this is dealt by a urologist. As a urologist, that we deal with all urinary aspects of women as much as men. We need to look at this awareness going to the society, to your homes, where your mothers, your grandmothers, your sisters, and women in the society need to know that this is completely treatable. Over the last 25 years in urology, deeply looking into this aspect of women's urology, which is so much of an anxiety, bother, so much of despair and dilemma as to whom to go to. Many women go to family practitioners, many women go to gynecologists, and few only go to urologists. A urologist is dealing with urinary issues of women, includes all. On one side, the recurrent urinary infections, other side, the continence and control of urine, other side, the blockages will develop as a result of which the urine flows lesser, and aspects of fistula and leakage of urine from the vagina and from the rectum. So that we look at the kidney and the urinary health of all individuals. It is important as urologists that we come to you, spread this awareness to society and to all women in the world that this is treatable and curable. Let's not live with incontinence, but let's leave incontinence. So the workup of these individuals and their treatment is again very tailored, what I call as right approach to the right individual. Let's look into that. So women across the world need to listen to this. They need to know that leakage of urine is not acceptable. And don't take it as a normal, graceful aging that you need to live with incontinence. Women who have to be living with diapers is probably quite a dilemma. They don't know whom to go to, and they probably don't get treated. And I get to treat certain individuals either with medicines on the overactive bladder side, failing which we use botulinum toxin and sacral neuromodulation. On the other side, stress incontinence treatment today is by those wonderful slings which are called pivovaginal slings. These slings are also mesh. These slings are also autologous and depends on whom to give what. Obviously, there were the previous surgeries called the burst corpus suspensions and various kinds of needle affairs. But again, we need to tailor it to the right individual. We do a cystoscopy, we assess you, look at any cystocele, the vaginal health of changes in the hormone levels, and the surgery doesn't last long. So what we call as surgery is a minimally invasive treatment where we bring about a support back to the pelvic floor. You're not living on diapers anymore. You don't have to wear diapers and you're not coughing, leaking urine whenever you cough, leak, run, jump, and even laugh. So to bring laughter, the best medicine back in lives of women, it is important that they laugh loud and clear and don't leak urine. They don't have to rush to the washrooms, get down from buses and trains and search for washrooms, or unfortunately drink less water. It's time to bring this incontinence aspect into the minds of women who leak urine, and all women watching this today happen to be ambassadors of the subject where incontinence is treatable and curable. Let's not leave women in this country, in this world, being incontinent all the time. At the Kokilabhen Dhirubhai Ambani Hospital, the motto of every woman's health improving in urology is an important aspect of care. Thank you for taking this awareness drive to the society, sharing with individuals, subscribing to this channel, and letting people know that there is treatment available. Sadly, awareness on many urinary and sexual aspects is missing, and that's why on an attempt to bring about this important prowess, we look at speaking to you all the time and looking at your feedbacks, interactions, and taking it forward. To reach me at the Kokilabhen Dhirubhai Ambani Hospital, you're welcome to walk in. You're welcome to take an appointment from anywhere, or there's an online consultation for individuals on the hospital website where you could always connect. Best wishes to everybody. Let no women continue to leak after these kind of awareness attempts that we make at the Kokilabhen Hospital. As I sign off, Dr. Sanjay Pandey from the Kokilabhen Hospital, it is important that I take this attempt again and again back, reminding individuals that urinary incontinence is treatable and curable. for children, for men, women, and elderly. So why live with leakage of urine at all? Why live on diapers? Please come out of it and lead a better life for the future. Thank you.